Here at the Total Joint Center, procedures of the shoulder, hip, and knee require anesthesia before surgery. There are two types of anesthesia we may recommend: general or spinal. In addition to your anesthetic, you may also receive a peripheral nerve block, either an adductor canal for knee replacements or interscaling block for shoulder replacements. General anesthesia has been the norm for some time now and has historically been recommended for procedures that take a long time, result in a lot of blood loss, or affect your breathing. This type of anesthesia puts you into a sleep-like state through a combination of intravenous drugs and inhaled gases. During the operation, you will have no feelings of pain, awareness, or movement. While it is generally safe, there are risks involved with general anesthesia. These may include damage to the teeth, tongue, and lips when placing airway devices, post-operative nausea and vomiting, sore throat from breathing devices, and prolonged recovery from anesthetic agents. Fortunately, most of these risks are small and all are treatable should they occur. The protocols for patient discharge after surgery are changing. Many times, patients can be released from the hospital the same day or the following morning after their joint surgeries. The Total Joint Center at the Lifespan Orthopedics Institute has been using alternative types of anesthesia that are safer, more suitable for joint replacement surgeries, and allow for a quicker recovery.